welcome to the first ever wellness community, Covenant Wellness Community, I should say. And by the way, we haven't named this facility yet, so if anybody has a great idea for a name, Chris McLeod's around the corner right there, and he'll take your suggestion. But it's my honor to host this announcement today. My name is Tim Spelliscy. As I mentioned, I'm the chair of the board chair of Covenant Health. Before we begin, I'd like to acknowledge that this announcement is being held on treaty land, and this land holds stories of resilience, displacement, and profound connection. This land is living. It recognizes the histories of First Nations, Métis, and Inuit, and the enduring power of community. We all have a responsibility to walk in partnership in pursuit of health and equity, and our past calls upon each of us to ensure that our future is lived with compassion, social justice, and integrity. We thank you very much for attending here today, and it's a pleasure to turn the podium over to my good friend, a good friend of Covenant, and a mentor of mine, our board chair emeritus, the Honorable Ed Stelmach. Ed?
Well, thank you, Tim. It's wonderful to join everybody here today at this event, and in behalf of our board chair and on behalf of Covenant, introduce our Honorable Premier Smith. As Premier Smith said before, not all roads lead to hospitals, and that is entirely true. As Tim mentioned, this is our first Covenant Wellness Community. It's a new model that is intended to help solve some of the biggest challenges in healthcare and make hospitals work. This is just one of the ways Covenant is strategically partnering with the province of Alberta. It's a relationship that goes back to the very founding of this province. As former Premier of Alberta, I know that Albertans care very deeply about their healthcare system. And as a former Premier, I know we all worked hard to strengthen the healthcare system, and I'm pleased to see this government continuing this important work. Furthermore, my tenure as serving as chair of Covenant's board of directors only strengthened my commitment to fostering a strong health system that all Albertans need. As many of you know, Covenant has a 160-year history of serving Albertans. One rooted in compassion, partnership, and a deep commitment to meeting people where they are. What has always stood out to me is the way that Covenant shows up, not only as a provider of care, but as a strategic partner in shaping the system itself. Covenant's ability to collaborate, innovate, and respond to community needs continues to strengthen the fabric of healthcare across Alberta. That spirit of partnership is especially important as we navigate a health system that is evolving rapidly. Physicians are a critical part of this system, and that's why it's so significant to be here at the Covenant Community Health Centre today, steps away from our brand new Covenant Family Health Clinic. Premier Smith is central in the role of stewarding system-wide collaboration in healthcare. She's deeply committed to developing solutions that work for Albertans. We have a close relationship that goes back many decades. So it's my pleasure to welcome Premier Danielle Smith and Minister of Primary and Preventive Health Services, Adriana LaGrange, to make this historic announcement. Premier?
Well, thank you so much, Premier Stelmach, for being here today. Thank you to Tim as well, Tim Spelliscy, who's the new board chair of Covenant Health, and as well Adriana LaGrange, Minister of Primary and Preventative Health Services. And thank you for joining us at the Covenant Wellness community, and thank you for hosting us. I think I may as well say what everybody is thinking. The obvious name for this place is the Ed Stelmach Health and Wellness Center. Not only to acknowledge the incredible work that Premier did it as a Premier of this province, but when you think about the fact that he committed himself to making sure that Covenant would stay strong and have strong leadership all through the time that he has not been in publicly elected life. And I think you'd also avoid a problem that we have in Calgary where we've named a couple of things the same thing, like South Health Campus and South Health Hospital. People don't know the difference. So I think that we have a long history of naming our public buildings after public figures of note. And so I'm going to put that in for my vote, Tim. Don't know how you're going to decide that. But this is obviously a state-of-the-art facility, but really it is the people that make it so fantastic. It's the incredibly skilled, endlessly compassionate medical professionals who staff the system that make it so successful. Medical professionals in Alberta do everything from roadside emergency care to bedside patient care to brain surgery. And we've recruited them by the thousands in recent years. Since 2019, we've added 2,060 doctors, 12,000 RNs, 3,400 LPNs, 1,300 paramedics, and over 12,000 healthcare aides. And we intend to keep on going. To 2030, we're increasing RN grads by more than 48% and LPN grads by 44%. And we're expanding our faculties of medicine to train 100 more doctors, including those in Grand Prairie and Lethbridge, so that they are trained in different communities. When it comes to doctors, I'm happy to announce that Alberta's government is also investing to hire many more of them while keeping the ones that we have. As part of Budget 2026, we will be spending $7.7 billion paying physicians. This is an increase of $1.4 billion, or 22% more than last year, and the highest amount in the province's history. And we're doing this for two reasons. First, we want to maintain Alberta's reputation as a fantastic place for doctors to practice. And this funding will ensure the province's physicians are well supported and competitively compensated. And second, we want to attract, recruit, and retain physicians across the province with an appropriate mix between urban, rural, and remote communities. Alberta is now home to more than 5 million people. Our population grew by almost 600,000 people in just the last 5 years alone. We've been increasing the number of doctors to keep up. At the end of last year, the number of physicians registered in the province was at a record high, and so was the number of family doctors. In fact, it's 1/3 higher than it was a decade ago. The latest statistics from the College of Physicians and Surgeons show that we are gaining doctors in Alberta at a faster rate than population growth, which is a major win and will help Albertans to find family doctors. We now have 6,362 family physicians registered across the province, an all-time high, and an increase again of 1/3 over the last decade. We expect these figures to keep rising in line with population growth and our promise to protect and improve Albertans' access to care. So we're investing accordingly. Albertans are suffering from overburdened healthcare services, and ever since we were elected, we've been expanding capacity, cutting bureaucratic waste, and sending resources to the front lines. From primary care to continuing care to mental health supports and addiction treatment, we are investing and building. We don't consider this an issue to be managed. We consider it an issue and a problem to be solved. Healthcare is one of the most important factors in everyone's quality of life, and Albertans deserve easy access when they need it and close to where they live, and that's exactly what we're delivering. And Minister Adriana LaGrange has more to say about this investment, what it means for physicians, and how we're continuing to fix healthcare. Minister.
Thank you so much. Thank you, Premier, and good afternoon, everyone. As the Premier noted, this year we are making a record investment into physicians in this province. This is great news for patients and another chapter in Alberta's growing success story. Our province is growing, our communities are growing, and the demands on our health system are growing. Over the past several years, our government has stepped up to meet this pressure head-on. We've listened to our doctors. We have worked collaboratively with the Alberta Medical Association, and together we created a new primary care physician compensation model that reflects today's reality. And the result has been successful. Alberta's primary care compensation model is designed to be very competitive financially, as well as a better support for comprehensive patient-focused care. We've also heard that shifting to this model could be challenging, so we provided $200 million to help physicians transition, and another $57 million to provide family doctors and nurse practitioners with extra support to help manage their increasing patient numbers. All of this came on top of the $780 million in new investments that were negotiated as part of the current AMA agreement to stabilize the health system. These are major investments, and the results speak for themselves. Today, there are well over 13,000 physicians registered in Alberta. That's an all-time high and a 3,300 increase of physicians more than a decade ago. That represents a 34% increase. By comparison, in 2019, we were at about 10,600 for those that are doing the math. And nowhere is that progress clearer than in primary care. As the Premier noted, more than 6,300 family physicians are practicing across Alberta, alongside nurse practitioners and other providers. This, again, is another record high. If you go on to the newly updated Alberta Find a Provider website today, you will see that there are over 700 doctors currently taking new patients right across this province, and that is exceptionally good news for Albertans. Now we're also stepping up in another area. If passed, Budget 2026 will invest a total of $7.7 billion in physician services and development next year. That's a $1.4 billion increase, or a 22% increase over last year. Of that total, more than $7.3 billion will support physician services, funding treatments, appointments, and training, so Albertans can get that care that they deserve. It also includes $450 million to help recruit and train more doctors so we can improve access in places where they need doctors the most. We continue investing not only in doctors, but also in nurse practitioners, registered midwives, registered midwives, and all the healthcare providers right across the system. So this funding will help reduce wait times, improve access, and strengthen care in every region of the province. At the same time, we know Albertans expect us to use every taxpayer dollar wisely. That is why we are also working to create the sustainable system that Albertans deserve. A system that is focused on fixing the challenges facing today's healthcare system. A system that is grounded in collaboration, fiscal discipline, and that delivers reliable access for all Albertans. Thank you very much, and I look forward to announcing more healthcare funding details and the record-setting $7.7 billion investment for physicians after the budget is tabled, which will be happening later this week. Thank you.
Thank you, Minister. Premiers. We'll now go to our media Q&A. We'll start off with questions here in the room before making our way to the phones. A reminder for one question, one follow-up, and to state your name and outlet before asking your question. We'll go to our first at the mic.
Hi, Premier. Sean Amato with City News. So more than a month ago, your hospital's minister promised that triage physicians would start immediately. He used that word at least 3 times, immediately. But it's been more than a month and those physicians don't exist yet. Why did your minister break that promise? And why should people trust that the promises you're making today will actually be followed through on?
Well, I hope that the AMA will work with us on getting those positions in place. There's, I don't want to get into details at the bargaining table, but we're about to enter into bargaining with the AMA at the beginning of March, and I think that we share a common aspiration of improving the conditions in ERs. If it turns out to be the case that doctors are not interested in filling those triage positions, we can look at nurse practitioners, we can look at physician's assistants, but we want to make sure that the AMA and their professionals have the first opportunity to help deliver this new form of care for those in the emergency departments. Did you want to say any more on that, Minister?
Just that I know that Minister Jones is working very closely with the AMA and all of the officials to make that happen. And it really is, there is negotiating going on, and that sometimes takes some time.
Premier, we're hearing from immigrant communities that some of them are quite upset about some of the, well, all of the referendum questions you're putting forward on immigration, including Dr. Raj Sherman, who says that they're divisive and this is not what Alberta needs right now. He's actually calling for new leadership, a new premier. How do you respond to that, and why is it important to put those questions forward at this time?
Well, I wish Justin Trudeau had put the question forward when he upended 40 years of established immigration policy, but he didn't. He increased and basically took all the limits off all of the temporary program streams, international students, temporary foreign workers, especially low skill, as well as asylum seekers. And as a result, we ended up with an imbalance. Our historic system gave points based on an individual's ability to integrate seamlessly into the economy. They had to have certain job skills, they had to have facility in one of the 2 official languages, and that was the priority. And what we see instead is that our repeated calls to return to that priority have been ignored. We have been asking for some time to have about 30,000 provincial nominees chosen by the province, very similar to what Quebec does, in order that we can provide the demand that we're seeing for provincial nominees, including since we have a large number of Ukrainian evacuees who settled here. And they keep saying no. In fact, instead of increasing the number, they keep decreasing it. And so they're going in the wrong direction. And so what we are asking for is, can we have and should we have a style of immigration agreement with Ottawa that replicates the 1991 agreement that Quebec has with Ottawa. Since 1991, Quebec has had total control primarily over economic migrants. Now, they make a choice to bring somebody in based on whether or not they can speak French so that they can integrate into the economy. We want to make a choice based on whether someone has a job and is able to begin work as a taxpayer and then ultimately move on to permanent residency and then ultimately citizenship. And we need to see a dramatic reduction in all of those other streams. Unfortunately, the federal government agrees. I mean, and anyone who's complaining about this hasn't been watching what's happened since Prime Minister Mark Carney got in. We have seen a decrease in the number of temporary foreign workers, and they're willing to collaborate with us, a decrease in the number of international students. We still have more work to do on asylum seekers and who pays for the long-term support of those asylum seekers as they're waiting to see whether their claim is legitimate. But we want to have control over economic migration because the current system got blown up in the last few years, and we're asking Albertans, which was something they should have been asked a few years ago when all the policies changed, whether they want to go back to something that approaches a more normal immigration policy like we had for 40 years.
Thank you. We'll go to our next with the mic.
Thanks, Lisa Johnson with Canadian Press. Just to keep you at the mic, Premier, on that topic. Do you know, or can you say for certain that the immigration policies you're putting forward on the referendum ballot, if they are constitutional? And I'm asking just because Minister Amory, it was a little bit unclear. He wasn't able to say last week if the results would be binding. So can you say for sure that they are constitutional questions?
Well, I can tell you that Section 95 is a section of the Constitution that we've not tested before. And it does have 2 areas of jurisdiction that are joint. And if you read it, it says that the province shall make laws, which seems to imply that the province should take the lead on policies regarding agriculture and on policies regarding immigration. And the language that they use for the federal government is the federal government shall make laws from time to time. And so it does seem to me that Quebec is the only one that is exercising the spirit of what that meant, is that you have to have the provincial leadership role in ensuring that newcomers match the needs of the economy, and then the federal government ultimately determines citizenship, asylum seekers, and some of those other aspects. And so I would say that if there is any kind of constitutional discussion, I guess we can battle it out in the courts, but it's already been well established in Quebec since 1991 that they do have the right to do it, and we do too. When it comes to the other ones, those of course cannot be done unilaterally. If you look at the abolition of the Senate, which is one of the issues that's on the table, that would have to be done with an agreement, I believe, of all the provinces and the federal government. So it requires unanimous. There's different amending formulas. The other issues around asserting that provincial laws should take paramountcy over federal laws in our areas of jurisdiction, that would require the amending formula of 7 out of 10 provinces representing 50% of the population. Same with opting out of federal programs and receiving the money for it. That might be a negotiation that we can have as opposed to a constitutional amendment. And the appointment of judges. I believe that also would require all of the provinces to agree, and we're already hearing that other provinces are in agreement with us on that. So we want to move forward on some of the things that we heard during the Alberta Next panel, some of the ways to reset our relationship with Ottawa, create a new relationship, so that people can have hope again, that Canada can work. That's one of the things that we're seeing is people are very frustrated, and this is our answer to addressing some of the legitimate concerns and grievances that Albertans express to us.
Thank you. I have a follow-up. Maybe one of my colleagues wants to ask about the legislature sitting that's coming up tomorrow, but if you want to weigh in that. But I have a question for my colleague, for Minister LaGrange.
Sure.
Haven't seen you for a while. Nice to see you, Minister.
Nice to see you.
So we saw measles advisory in Parkland County last week. I'm wondering if you can give us some more details about where it's coming from, where it's spreading. Parkland County officials say they haven't gotten any communication from the provincial government on this. So can you say what's going on, and why aren't you communicating with local officials directly?
Well, the MOH in the area has been communicating with the Chief Medical Officer of Health and communicating out to the areas, like to all of Parkland County, to actually share that there is individuals. My understanding last week there was roughly about 17 individuals that had contracted measles, and so there was a concern to make the whole area aware that it is out in that area. They couldn't pinpoint it to a specific location or group, but just wanted to make sure that people had that awareness. So I spoke with the Chief Medical Officer of Health just on Friday, and they felt this was the best approach, put it out as a bulletin so that everybody is aware. So I would say we are on top of it and we are aware of it. We've spent over $1 million this year making sure that people have an increased awareness of measles and other respiratory virus issues that are going on right now within the province.
Thank you.
And I'll just add that the minister created a measles dashboard similar to our respiratory virus dashboard, and we update that annually so people can see where we were last year compared to where we are this year, which zone has the outbreaks, which outbreaks are now resolved so that they're no longer contagious. And there's also a click-through so that where we know it, you can see where the last exposure was and the time, so that anybody who was in that vicinity can know to protect themselves as well, plus the vaccination campaign that we've done to raise awareness. But I think we're up to 93% of Albertans are vaccinated by the time they reach age 17. And so you want to get to 95% to have full protection, but we've seen that those numbers remain quite high.
There are currently, there's currently 2 active cases that we're aware of right now that are contagious at this point in time in the whole province.
Thank you. We'll go to our next.
Amanda Anderson with CTV here in Edmonton. I want some clarification, I guess. How much of this the 1.4 investment, or does it factor in I guess the additional money that was mandated through arbitration for doctors, bumping them up this year to 3% as opposed to the 1% that they had in their contract?
So I think you're a little confused on the numbers. So there was an agreement, the current agreement with physicians was 1% over the first 3 years, and then there was a wage reopener, and that went to arbitration. I'm not at liberty to speak to that at the moment, just because of the contractual pieces of it. That being said, this is additional dollars on top of what was negotiated through the contract.
And then my other question is, I know that we've been hearing that there's been a shortage of physicians in certain areas. Some are anesthesia, general surgery, obstetrics, general internal medicine, cancer, hearing that doctors are being lured to other provinces. So how is this investment going to, I guess, keep doctors here, and how is it going to fill some of those gaps?
Well, having worked very closely with the College of Physicians and Surgeons over the last couple of years to really look at streamlining our processes, and that has worked tremendously well in conjunction with the work that we've done on the PCPCM for family physicians. But on the specialist side, what we were seeing is that there were bottlenecks in the system. So international medical graduates, they had to be sponsored by AHS. Now they can be sponsored through clinics, through various programs within the system. And that has increased our numbers, not only on anesthesia and some of the other specialties that we were having issues with. We've been able to recruit oncologists. Being a cancer survivor myself, I was just recently at my appointment, and I know that we've been able to recruit more eye oncologists. That's my cancer was eye cancer. So we are seeing that 3,000 number that we've increased overall in the province is about a 50-50 split with family medicine and specialists. Not to say that we don't need more, particularly as we're aging and as our population grows, etc. But we have been very successful in recruiting in a lot of those disciplines. There are a couple of hot spots in the province in terms of family medicine where we're still having difficulty recruiting. But the program that we introduced, the Medical Resident Rural Remote Bursary Program, is actually helping us to recruit to those rural remote locations on a 3-year return of service. So we've got 130 medical residents that have now agreed to work in those environments as well. So is there a silver bullet? No, but all of the incremental changes we're making are having a huge impact right across the province.
Yeah. I can tell you just in my own riding, they were able to successfully sponsor an international medical grad because they can do it now at the local level as opposed to through AHS. So that was one thing, to make more doctors able to do that sponsorship. Also, they're doing some really interesting work in rural communities where this municipality is putting up the support in order to attract a doctor. In Brooks, for instance, they're looking at buying a home, having a car, making sure they've got a line of credit so that somebody has a very easy landing point and then can work seamlessly in the community. And I believe it's $250,000 that is the bursary for the return of service going into rural communities. And to have 130 who've taken us up on that, I think we'll see more. We also have nurse practitioners, and we have an incentive to have them go to the areas that are underserviced. I don't know if any other provinces have yet followed suit, but they're able to now bill us directly and provide a service of primary care in communities. We've got 90, I think we've got another 10 that are in the queue, so that has been a very successful program as well. But when it does come to specialists, part of it was making sure that there was a 2-year ramp up after the Arthur Child Center got developed. And that is going to be, I think, an amazing attractor for oncologists, because a lot of specialists want to also be able to do research. And I think that its combination there with the University of Calgary is going to be extraordinary. The other thing I would say is the issue we hear over and over again from doctors, whether they're primary care practitioners or specialists, is the issue of administrative burden. And that's, again, what we'll have to talk with the AMA about. We managed to get to a very successful bargaining on a brand new doctor's contract that created patient panels, streamlined billing, fewer billing codes, and some sort of expectation about what office hours would be. That's probably a good model for some of the other areas to make sure that they have stability in income, but that we're also getting what we need in seeing additional patients being treated. So I think that there's going to be I hope there's a meeting of the minds there as we go through this next round of negotiations, but I think that is going to be where we make our biggest progress, is in finding a way to reduce that administrative burden.
Thank you. We'll go to our next question at the mic.
Hi, Jasmine King, Global Edmonton. This is for the Premier. How do you hope that this investment really helps out our healthcare system in the immediate future?
Well, I can tell you The 600,000 new individuals and patients coming into the province in the last 4 years is an extraordinary increase in population, and so it just requires more individuals to be able to treat those patients, whether it's going to be in the community for a primary care practitioner, in wellness centers like this, so that there's another place for people to go to get the care that they need. But then, if you do need to have a journey where you have to have surgery and go to hospital, we need the specialists as well. And so we know that there have been disruptions in our ability to attract in previous years for a variety of reasons, COVID being one, and contract negotiations being another. But I feel like we've got a really good starting ground and common ground of understanding with the AMA, and this is a measure of good faith for them, that we're prepared to invest. But we also want the service improvements, as do they. So I'm looking forward to starting off those negotiations, which I think begin in March.
And you mentioned the recruitment numbers. Obviously, you just spoke about that as well. But I mean, is there a number that you would like to see for more physicians that you would like to come to our province?
Well, we're still in the growing process, so I would say we will, for my metric, every Albertan attached to a family provider, a family health home, would be ideal. And so, when I first started, there was roughly about 600,000 Albertans who were not able to find a family practitioner, and there were, if you went on to find a doctor, there was limited number of doctors, less than 100, I'm sure, that were taking new patients. As I said earlier, to see over 700, and if you include the nurse practitioners and midwives, we're closer to 800 practitioners that are now accepting new patients in the province, and more all the time coming. I hear a lot of great interest from physicians in the UK that are looking at Alberta as an attractive place to practice, other provinces, physicians from the US as well, and other countries. We are a desirable place to come. It's obvious with the fact that we've been able to attract over 3,000 just in the last 2 years alone. It's amazing. So that's going to continue. And as we build beautiful facilities like this, we will need more physicians to be part of that care team. And we really are looking at care teams as well, that team aspect. Go to the right practitioner for the right reason at the right time. And that's essential.
And I'm going to put the minister on the spot, because I know that she's developing a metric that she's soon going to make public of how many patients are attached to a family practitioner, how many are looking and still unattached, and how many aren't looking. That's another important category. There's some people who are not looking to have a family doctor, but she had told me that she had a date set for when that was going to be added to the website, so maybe she'll tell us the date today.
Thanks, Premier. To go on this spot, we will have that by April 1st at the latest. I'll put it that way.
Thank you. And we'll take our next question at the mic. Yeah.
Hi, Emily Fitzpatrick, CBC. With the $1.4 billion on top, the extra $1.4 billion, is it clear where that's going? Is that to recruit more doctors? Is that to pay doctors that we have more currently? Can you give us some insight?
Well, I can tell you, I think we've got something like 132 alternative payment plans with various doctors and specialists. So that gives you some idea of the complexity of the AMA negotiations. I think we got to a really good place in our negotiations with nurse practitioners and family doctors, but now we have to work through all of the different specialties. And part of that is going to be looking at where we are relative to the number of specialists in other large provinces, and whether there are some that we need to do more attraction for and others where we're doing just fine and don't need to prioritize attraction. So that process is going to take some time, and it has to be done in good faith with the AMA in identifying that. But so we can't really say exactly which specialties will get which boost at the moment. But we will be working that through the process of negotiations, which again I mentioned begins in March. Did you want to say anything more on that?
No.
Yeah.
Just we're going into negotiations, so I can't really be specific on anything. But that being said, it is going to physician compensation.
Yeah.
And for the per capita of working doctors, you gave us a little bit of insight, but can you give us a little bit of how it has increased or decreased maybe in the last 5-10 years or so? In terms of working doctors in Alberta?
working doctors in Alberta? Well, as I said, we had roughly about 10,600 physicians registered to practice in the province. So when we look at that number, we're now at 13,700 and counting. As I say, there's a lot of interest, especially since the College of Physicians and Surgeons started the Accelerator program, that if you're from a designated area and a designated program, we can fast track you into the province. And so that has been a huge boost. When they started that program in the summer, I think we've seen approximately 400, 500 doctors already express interest. So there's a lot of interest out there for people to come to Alberta, physicians in particular. Yeah.
Awesome. And we'll have time for a few more questions. We'll take one more from the mic and then go to the phones.
Thank you very much. My name is Jules Bonnet for Radio Canada. I've got a question about the NPD's leader, what he said this morning, saying that it's not normal for a government to be unable to balance the budget with current oil prices. And I would like to know what you could say regarding that critic.
Well, I can tell you that our budget, and I've always been very clear about this, our budget needed $74 oil in order to balance. And that's why we've been able to run not only balanced budgets, but surplus budgets for the last few years, pay down debt, and increase our Heritage Savings Fund amount. We paid about $15 billion worth of debt, much of it racked up during the NDP years, I would point out. And we also doubled the size of the Heritage Savings Trust Fund from $16 billion in 2021 to now $32 billion and rising. And so just sticking with that strategy over time will get us to $250 billion in that fund, so that when we have this kind of drop in resource revenue, we can draw on that fund to provide a stabilizing factor so we don't have to go into debt. I wish that the NDP had started that policy of reinvesting investment income when they had the chance, but they didn't. And so we did, and it's already paying dividends. So when you look at the numbers, and I made it clear in my address, that going from $74 WTI to averaging $60 or less, as we have this past year, blows about a $12 billion hole into our budget. And that is, fortunately, it looks like because it's come up a little bit, our deficit for last year is going to be a little bit smaller than what we projected last year. But the facts remain the same. We need to be honest with Albertans about what the worst case scenario is when we go into budgets. We're not going to put on rose-colored glasses and pretend that the numbers aren't what they are, to pretend that the relationship and the tariff threat is not having some instability, and pretend that we can balance a budget when we know it would cause devastation. To try to cut billions of dollars out of a health budget right now, and I invite the NDP leader to tell me where. Would he not announce this today? Would he not hire doctors? Would he close down practices? Would he blow up hospitals? Or education? What would he do? Would he not build the schools that we need? Would he not have unrolled the complexity teams that we did so that we can deal with complexity in the classroom? Would he not? Well, we know he wouldn't fix water pipelines. We already saw that demonstrated. He had 11 years to do it and chose not to. Would he not build the Green Line LRT? Well, I guess we know that he didn't have a plan for that either, because it ended up being 5 times what he put on the back of an envelope. So we're making investments in the things that we know Albertans need and want, knowing that this situation we find ourselves in is temporary and that we can weather the storm. But we have to be honest with Albertans about where we find ourselves.
And can you talk today about how big will the deficit be? What can we expect?
You'll see on Thursday. Yeah, but I can tell you that last year we were looking at a $5.2 billion deficit when we went into the year, and then it went up a little bit by Q2, and you'll see the Q3 results as well. The Q3 results have come down a little bit for what the deficit for this year will be, but you'll see what we anticipate, once again, in a worst case scenario, if these prices hold at the level that they've been in the last year.
Thank you.
Yeah, you bet.
We have time for 1 or 2 more questions. We'll go to the phones. Operator, can you put through our first caller, please?
Your question comes from the line of Will Butter from Western Standard. Please go ahead.
Hi, Premier. I'm just curious. Yesterday, Thomas Latazik, he doubled down on his comments comparing your approach and your rhetoric on immigration to those used by Nazis, and he said that he hoped that it made you reflect a little bit. Could you comment on that?
Well, I hope he would reflect on the reaction from the Jewish community, including the Edmonton Jewish community. If you're going to invoke Nazis and Holocaust, you better be talking about real Nazis and the real Holocaust, which caused devastation to the Jewish community. And so he should apologize and stop using that language and have a mature discussion about what it is that we're trying to address here. The mature discussion is we have a problem. We have a problem that oil revenues are unstable at the moment because of decisions of previous years of governments, his included, that we ended up with over-reliance on oil and gas revenues. We're trying to correct that by having a long-term plan with the Heritage Savings Trust Fund, by building pipelines that should have been built over the past 10 years, but weren't because of actions by the NDP Liberal Coalition in Ottawa. And so we don't want the same lost 10 years going forward, and I'm happy to have an MOU that looks like we're going to see a number of pipeline projects go ahead. That's a midterm solution. But the short-term solution is we have to have really tough questions being asked and answered about how we make sure that newcomers are able to integrate into our economy, and when they arrive that they've got a job and supports in order to be able to do that. Because of the policies of the federal government over the past 3 years under Justin Trudeau, we've ended up seeing a complete upheaval in what people came to expect of how our immigration was supposed to work. So we are asking Albertans, since it's a change, should we be taking over the economic migrant portion of immigration away from the federal government, similar to the way Quebec did back in 1991? And should we be putting some limitations over how long you have to be in our province before you start relying on social programs? Social programs are expensive. The average person who comes to Alberta needs about $6,000 a year in healthcare, and sometimes it varies. Some people need very little. Sometimes people need hundreds of thousands of dollars. That's why we have an average. But there's always a certain portion that are going to be at either end of that. It costs $12,000 for someone to go through and get support in our childcare system. It costs $12,000 for a child to get support in our K-12 education system. The only place where we do have foreign students paying their way is in universities. And so we're just looking at having the same kind of policies that we see elsewhere. In Ontario in particular, they do not allow the families of temporary foreign workers to automatically get access to health care. The federal government just recently issued a circular saying temporary foreign workers are expected to have private insurance when they come here. And it just stands to reason. If you're going to a country temporarily, every Canadian knows you've got to get yourself covered for insurance. You don't show up on the doorstep of another country and say, hey, pay for my health care, pay for my kids' education. We just need to have the same kind of normal policies that they have in other jurisdictions.
Thanks. And then my follow-up on that, it's a referendum question, but it's not immigration on this one. It goes to the question on abolishing the Senate. I know it was one of the recommendations of the Alberta Next panel, and so I guess I'm speaking to you as the Premier, but also the chair of the Alberta Next panel. The survey showed only 7% support for the government advocating for the abolishment of the unelected Senate. And so I'm just curious what made you decide to put that question on this referendum.
Well, I guess we have to ask if we're going to continue the charade of having Senate elections every election cycle and having it ignored by the federal government. And I guess we have to ask ourselves, are we going to live with the charade of pretending at some point Quebec is going to agree to have the same number of Senate seats as we do, and that the Senate is going to be equal and elected and effective? I know that there are a number of people who maintain that hope, but it costs money for candidates to run in that election. And if they're just going to be ignored, then why are we doing it? And if they're just going to be ignored, then what's the Senate for? The Senate was always supposed to be to represent regional interests, if you go back in the history books. And in point of fact, it's not. Right now, it's a partisan chamber. And the people who are appointed probably wouldn't be able to get elected to public office. And I question whether or not they actually represent the views of the majority of Albertans and advocate on our behalf consistently. So that's what I'm putting to Albertans is, do we want to continue doing Senate elections? And if that's what they decide, okay, I guess we'll have another Senate election on the next ballot. But if not, then I'll be advocating for something different.
Thank you. And that's all the time we have for questions today. Thanks, everyone, for joining us.
Thanks, everyone.